Good.
Do I have to stop HRT before my surgery?
Ooh. Yeah. Yes and no. I'll try and give a more clear answer than that. So HRT means different things, but it's usually a combination of estrogen and progesterone, but for some people it's just estrogen and some people it's just progesterone. If you are just taking progesterone, you do not need to stop it. Progesterone has no effect on surgical safety, and when I'm talking about surgical safety, I mean your risk of blood clots. So there is no added risk of blood clots by taking progesterone only, so ignore the progesterone. In any formulation, however you take it, it's fine, carry on, you're good. And if that's all you take, therefore, you don't need to stop it. Estrogen does increase the risk of blood clots, and since surgery also increases your risk of blood clots, we tend to recommend that if you are taking estrogen, then you should stop it for 4 to 6 weeks before your surgery. If you're taking oral estrogen tablets. If, on the other hand, you are taking estrogen in any other formulation, transdermally, so in other words a patch on the skin, or as a gel, any other way of taking estrogen other than popping a pill, you can carry on with it. Why is that? It is because the increased blood clotting effect of estrogen appears to be the result of peak plasma concentrations that are quite high. So when you take a tablet, if you can imagine, it's this concentration of medication, and it goes into your stomach, and it then gets absorbed into your bloodstream, and you get this massive hit of drug, which then raises your blood levels of this drug, and then they just sort of tail off gradually as your body excretes the drug, and then you take another tablet and it does the same. So you get this kind of seesaw effect.
They're not seeing a hand.
They're not seeing a hand. You get this kind of seesaw effect of drug levels in your body. And the DVT, the blood clotting effect of estrogen, only happens when your blood levels are higher than a certain amount. So there will be times in the day when you're higher and times in the day when you're lower if you take oral estrogen. If you have a patch put on, that patch is a slow release patch. Same with the gel. It just releases a constant low level of estrogen all the time. So your blood levels rise, but they never get
DVT.
That's my line. They never quite get there. So you don't have an increased risk. So, summary. Do I need to stop HRT before surgery? The only HRT you need to stop is estrogen taken as a tablet. Estrogen taken in any other formulation or progesterone do not need to be stopped, and you can carry on with those. Yes? Question in the corner.
I presume it's the same for the pill.
Exactly the same for the pill. Exactly the same for the pill. So the oral contraceptive pill could be estrogen or progesterone, right? And if you are taking an oral estrogen pill, then I'd recommend you stop it. If you're taking the progesterone only pill, you don't need to stop it. If you're taking an estrogen secreting coil, then you don't need to stop it, and so on and so forth. If you have an implantable estrogen secreting device, you don't need to have that removed.
So it's to do with that DVT level and whether it gives you a peak or whether it's just a low level.
Yeah.
Amazing.
Now, the final point is some people take estrogen replacement having had their ovaries removed. And if you're taking estrogen replacement, you shouldn't need to stop it, because the estrogen replacement should just be releasing what you've already got rather than adding.
Oh, but is the estrogen replacement a tablet? So it's not like
various.
Is that a hit and then
various again?
Okay, so
yeah, various
a
again.
bit more of a discussion around that one.
Yeah.
Okay. So there we go. Thank you.